Okay, welcome everybody. Thank you so much for being here. I'm April Harrington. I am the project manager of the Chicagoland Healthcare Workforce Collaborative. We are here today to talk about career opportunities for nursing assistants. And we have a wonderful panel of 5 career pathway advisors here to share a little bit about their career journeys. This is an event that's part of a grant that we are managing, where we are training nursing assistants and patient care techs in partnership with 5 different employers and a few different training providers. The intended audience is those new nursing assistants and patient care techs. So maybe a couple of you here today are new CNAs or PCTs or have been training to become a CNA or PCT. Others of you are our partners, our training providers, and our employers. Thank you also for being here. We have a small group, so we should be able to have a very conversational event. This will be recorded and shared. So hopefully more CNAs and PCTs can view this content and we can share it with more of our group in the days to come. This is also the very first in a pilot series of events. So we'll learn from this and we'll figure out how to make it more accessible to more people as we go forward. So anyone who doesn't know what the Chicagoland Healthcare Workforce Collaborative is, we are a group of employers and industry partners, which includes training providers and community organizations who are united in our efforts to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. We focus on 3 strategic pillars: local and targeted hiring, so making sure that we have more inroads for people to enter the healthcare workforce; education and training. We work a lot to bridge the gap between employers and training providers to innovate in the ways that we're preparing people for our in-demand roles. And we also focus on retention and career pathways. And that's really what we're here to talk about today, is we want to make sure that once someone comes into the front line in healthcare, that there are opportunities to advance and that there are support systems in place so that people can move up the ladder, earn more, and fill our very much in-demand roles across the healthcare sector. Today, we'll spend the bulk of our time introducing our panel and walking through some preset questions where they'll tell you about their career journeys. Everyone on our panel started their career in health as a nursing assistant or patient care tech, and they have since been able to move along a career ladder into higher paid roles, into more skilled roles, and earn more credentials. So they'll share their stories. Then we'll have plenty of time for audience Q&A. So please feel free to put your questions in the chat along the way, or we can just come off mute and have a conversation once we're done with the prepared questions. And then finally, I have a short survey at the end for any of our CNA or PCT alumni or participants who are on the call. I would love to hear your feedback and how to make these events more effective and accessible for you in the future. Please stay on mute unless you're asking a question. Again, we are recording. I will be uploading it onto YouTube and sharing that link with our network after probably tomorrow, maybe in the next couple of days. And again, go ahead and feel free to use the chat. All right, let's go ahead and introduce our panelists. Today we have Latricia Lott, who is a lead medical assistant; Erin Boykin, who is a registered nurse and also works as a traveling nurse; Jenny Zavaleta, who is a psychiatry registered nurse, and actually she's a nurse practitioner. She'll tell you about that; Jamia Boykin, who is a social worker; and Jen Grenier, who is the associate chief nursing officer at one of Loyola's hospitals. Or yes, yes, Loyola Medicine's hospitals. Let me just stop sharing here. We can all see each other. And I'm going to put our discussion questions in the chat so that our panelists can read along, and everyone who's on the call knows what we are talking about. So first question, I am going to pitch to Latricia to kick us off with just introducing yourself and walk us through the early part of your career. What inspired you to pursue healthcare? And tell us about your experience working as a nursing assistant or patient care tech and what you enjoyed about that time in your career.
Okay, my name is Latricia Locke, and I am a lead medical assistant for UChicago Medicine currently. I started my healthcare career as a CNA back in 2002 is when I initially went to school to work as a CNA. How I ended up getting into that, I actually just needed a job because I had just had my daughter. But once I started school, I started like learning a lot about the medical field, the ethnics, the human body. So I became a lot fascinated with it. Um, so I started off working in a nursing home out in Willowbrook. And one of my very first patients, she had cancer. She was dying, and I got close to her. And so when she told me, I started to cry. And she took my hand and she said, "Baby, if you're going to make it in this field, you have to toughen up." And this was 20 some years ago. From there, I started working at Ingalls Memorial Hospital, where I learned that working as a CNA in a hospital and a nursing versus a nursing home setting is much different because in a hospital, you don't get as attached because you're kind of just moving. You're not spending as much time with the patient, but also you are able to utilize a lot of the skills that you learned in school. So a lot that I learned in school, I was able to use out in the field at Ingalls Hospital. I also used to follow my nurses around, and I used to learn how to do things like wound care and take out Foley catheters and things like that, for which is what interested me into going back to school for my medical assistant. And I went and did that in 2012, and I have been working as a medical assistant ever since. My journey as a CNA was uplifting because it introduced me to a lot of people. And in the healthcare field, we are all connected. Little do we know, we all run into each other. I always tell my peers and even people that come in that I have to precept, even students, externs that I get, you never know who is sitting in that chair. So just take care of them as if you would take care of your own. One story that I have, I was working on the neuro floor, and one young lady, her family was very upset. My shift started at 3, and all of that heat came to me, but I remained calm and I apologized and for the earlier encounters, and I took care of them. Little behold, once I started working as a medical assistant, this same young lady was working in a laboratory in Ingalls. This story she tells till this day of how I took care of her, and that's actually how I ended up getting a job working as a phlebotomist in the lab because her supervisor, and I didn't know at the time, she just kept telling her the same story. And I'm like, oh, it was nothing. To me, it was nothing, but to my patient, it was everything. So they remember the good and the bad. So always remember to treat people no matter how big or how small, no matter what the environment is, treat them with dignity and respect because we all come back around. So all of my externs that I get that's currently in medical assistant training, these are the stories that I tell. And a lot of them go out and they are successful. I actually got a lot of them in UChicago Medicine, fresh out of school.
Thank you, Latricia. So many things you shared are inspiring, particularly, you know, the fact that you keep seeing the same people all over the place, and that working in healthcare it takes a lot of heart and a lot of dedication. You are all heroes. Thank you for sharing your journey.
You're welcome.
Erin, pass it on to you. Tell us about the beginning of your career in healthcare. Ooh, and you're on mute.
Yeah, sorry. All right. So I actually started as a medical assistant, then flipped over to a CNA. I started working at a company called Access Community Health. I also worked at Rush University Medical Center. So I got the chance to work as an outpatient. And then I decided to go to nursing school. I attended school at Resurrection University in Chicago. And uh, because I did at least one semester of nursing, that qualified me to become a CNA. So I applied at St. Margaret's Hospital in Hammond, Indiana. And then from there, I worked in the ICU and the ER. I transitioned to Northwestern Medicine. I worked in the ER and surgical oncology floor as a PCT. And I learned a lot at all of my employers, something that I can take with me every step of the way. Eventually, once I graduated from Resurrection, got my BSN, I worked at Northwestern. So I stayed in contact with everybody, from the PCTs to the nurses. I transitioned from surgical oncology and went to the emergency department because that's the field I chose to go into. During COVID, I started traveling. And then I've been to Florida, I've been to Georgia, I've been to Indiana, I've been to Iowa, I've been to Minnesota, I've been to Wisconsin. Um, I have enough nursing licenses to travel to 45 states. Um, so now I am part-time at Advent Health Hinsdale Hospital in Hinsdale, Illinois. And funny thing, for my region, is actually co-owned with UChicago Medicine as well. Um, and I also attained my SANE certification, and SANE is a sexual assault nurse examiner. So for victims of sexual assault, I also attend to those victims, those patients, and advocate for those patients. And I still dabble and travel from here to there. So my last two contracts was actually in Springfield, Illinois, and in Champaign, Illinois. So that's where I am now. I love where I am, working in adult pediatric trauma, ER, and as a SANE. So what Latricia said is very true. You meet a lot of people, and the things that you do, it travels with you, and you start to make a lot more connections. So I fall back on all the connections I've made to put me where I am today.
Thanks, Erin. Yeah, that's a really good nugget of wisdom. Connections. It's all about connections. Um, Great. Jenny, let's pass it on to you. How did you start your career in health?
Hi. So I started as a CNA when I was 18, and I slowly worked my way up. I was paying for my associates while doing CNA. I worked at nursing home rehab and then went to the hospital setting, worked at St. Alexis, Rush, and Northwestern as a PCT. Worked everywhere while going to nursing school. Started my Associates of Nursing. I graduated in 2020. And in 2020, it was a fun time to graduate nursing. So I actually did agency and travel nursing as well, and I enjoyed it. I didn't do all that many states, but I had a few. I went to Washington State, Minnesota, California. So I have a few licenses too. I kept my RN licenses, and I graduated from NP school in February. Now, I didn't go to a 4-year school. I did my RN first, then I did my bachelor, then I did my master's of nursing and education, And then the pandemic, actually working with pediatrics and with children, kind of like opened my heart to psychiatry. And I was like, I need to make a difference with disparities. And I see my African and my Latino population suffering, and there needs to be help. So that's what made me decide to go into another brutal program, because nursing was hard as it was. And yeah, I mean, I'm happy now. I'm working as a nurse practitioner at private practices. And I also work as a psych RN as needed as a PRN position at Chicago Behavioral Hospital.
Thank you, Jenny. Kudos on all of those successful steps. And I like that you illustrate that that's possible to take these intervals to reach, you know, even your BSN and all the way through NP. Jamia, let's hear from you. We've heard a couple of nurses, but you chose to go a different route. Tell us about it.
Yes. So I started off as a CNA just wanting to go into the healthcare field. Becoming a CNA was actually the most affordable route to get my way into the door. Um, I started seeing a lot of places hiring for a CNA. And at that time, honestly, I didn't know what a CNA was. So I looked it up and I said, you know what, that sounds like, you know, a good foot in the door. So working as a CNA, I worked as a CNA primarily in supportive livings and home health care. I did in 2017 switch and actually started working as a hospice aide at Rush. And that is where I made the connection with the hospice social worker who gave me insight on what she did, how she interacted with the patients. And I said, you know what? That's what I want to do. That's truly what I feel like I have a calling for. So with staying connected with her, I was able to enroll in school. I went to Walden University. I did 4 years master degree program for social work. Right now, currently, I'm working as a social worker for behavioral health, so outpatient services. So after the patients have been in the hospital and they've gotten all their orders, then they come see me as outpatient ongoing care.
Thanks, Jamia. I think you really hit home a theme that's been coming up, which is just discovering your path along the way and being exposed to someone else and just knowing, hey, I want to do that. That resonates with me. All right, Jen Grenier, our last.
Thank you. Hello, everyone. My name is Jen Grenier, and I am the Associate Chief Nursing Officer here at McNeil Loyola Medicine as well. I'd love to hear all about this behavioral health. Everyone on here about behavioral health. I am the Executive Director over all of behavioral health services for all 3 ERs, our ambulatory setting, and we have a 69-bed inpatient psych here at McNeil. I was born and raised in the Chicagoland area. My dad was a cop and a fireman, and always knew I wanted to go into public service. I like my brothers and like my friends up here who have a sister that's a social worker and a brother that's a nurse. Same in my family. I have a sister who's a social worker. I'm a nurse, and another sister that's a teacher. So we all kind of went into public service. I started as we called a patient care tech. I hear a lot of my Rush colleagues here too. I started as a patient care tech when I was 18. I got my bachelor's at Millikan University and worked my whole time. My now sister-in-law, but it was my boyfriend's sister at the time, was a nurse at Rush. And she tapped me on the shoulder and said, you know, you should get your PCT. I think it's important to get your PCT before you go into nursing school so you could see what it's like and see if you like it. And I loved it. As you could tell, I could talk to a wall, so I'm pretty friendly. I could, talk to anyone, and started out in like the med-surg transplant unit. Loved it, loved the, kidney, liver, panc unit. And I worked every break I had. I'm sure like many of us on here, we still worked all through school. So when I hear some people are like, oh, I can't do it. And they're like, home by themselves, single, that no care in the world, when a lot of us had kids and, still trying to work a full-time job and go back to school. And so loved my experience as a PCT. And what was so great about that is that once I got into nursing school, I'm sure many of you could agree with that, I was like 10 times ahead of everybody else who didn't do PCT work at the beginning. So you get so much more experience, like because the nurses tap you on the shoulder and say, hey, come take this IV out or come take this Foley out. And when you're new to healthcare, you think that's the coolest thing, or help me with this dressing change, right? I stayed at Rush in the med surg unit for a while. And then if you ask what type of, I think I'm the oldest on this panel right now, right? I've been in healthcare for 25 years. And when I asked what type of nurse I was a trauma ICU nurse. Like I am ICU through and through, blood, guts, big surgeries. And I work night shift. I worked night shift my whole life. My whole life I was a night shifter, and same thing. My dad was, like I said, was a cop, and he was a night shifter. And I always worked the holidays. Santa came early to our house, and we thought we were so lucky because Santa came early because Dad always had to work. And same thing with my kids growing up, right? I worked night shift my whole life, and then decided to go back and get my master's. Knew I wanted to be leadership. So I was a charge nurse. I was involved in different committees. Knew I wanted the leadership realm. And then I had a mentor of mine tap me on the shoulder and said, you should come, run this unit. And I was went to Rush Oak Park for a little while, was a nurse manager over there. Came back to Big Rush, they called it, and was running rehab. And what I was actually full circle, I went back to being the manager of the unit that I started as a PCT. And then I decided to go back. I thought, I'm done with school. I'm never going back. I got my master's. Well, here's the other thing about working in healthcare, which is really nice. You try to find an organization that is going to pay for your school. Most of us in our different hospital settings have that. I know University of Chicago does. I know Rush does. I know Loyola does. We have big, reimbursements for everybody. So I was very lucky that Rush paid for my doctorate completely. It was completely free for me to go back and get my degree. And so went back. So I was silly not to. And when I said I'm never going back to school, but I did. I went back after school, got my degree in leadership, doctorate of nursing practice. And then I was like, all right, now no more school. It's a terminal degree. I don't ever have to go back. And then in February of 2020, I got offered an opportunity open here at Loyola Medicine for me to be the Associate Chief Nursing Officer. I was the director of CV at Rush when I left, and I was pretty much as high as I could go. And they've given me great, and I've been so lucky to work at two organizations that have just been wonderful to me. They have mentored me in different leadership opportunities. Came to Loyola then February 2020, 2 weeks before COVID hit. Great way to meet new people in the middle of a pandemic, and able to meet everyone. And then they asked me to run psych. So, then I was able to run psych. Am I a psych nurse? No, I have no experience in psych whatsoever, but I think that's what's so great in healthcare. My specialty right now is leadership. Can I go take care of an ICU patient right now? Sure. But my specialty is leadership. So I've grown from being a PCT to a med surg nurse to an ICU nurse to an ambulatory nurse to a manager, and now to an executive leadership in Loyola Medicine field. And I think that's what's so great about healthcare is that if you don't like one area, I could try something new, right? I always thought I was going to be a baby nurse. Ugh, no. Then I saw it and I was like, ew, no, I want nothing to do with OB. Just have my own kids. That's the only experience I have with OB. So, so went into healthcare thinking I was going to do one thing and then came out, really do anything else. I love being a nurse. I love healthcare. And it has given me so many opportunities, as well as my family, to be able to financially support my family and know that healthcare has given me that.
Oh, thanks, Jen, for sharing that incredible career growth. And I love that you started with, your time as a PCT was so critical and got
Yeah.
you on the right foot and
Yeah.
let you know that, yes, I do want to pursue healthcare.
Yeah.
So important, and leads me to my next question for the whole group, and I'll put it in the chat, is each of you shared a little bit about how you got to your position you're in today. I'd love for you to share a little more. What does like a day in the life of you look like? So share a little bit more of about your current position, what you like about it. And I'd love to hear if you're, what skills you practiced as a CNA or a PCT that you think have really helped you and you're still using today. So I'll circle back to Latricia to kick us off.
Okay. So for me, a day to day, even though I start at 8:30, for some reason my phone starts ringing at 7:30 with the other MAs. I pretty much work the ambulatory setting, so I work a multitude of different specialties. I currently have maybe about 22 to 23 medical assistants that's under me that I help coordinate their schedules, precept in different clinics, make sure that they are signed off on their day-to-day point of care activities. I also mentor externs that come from, I believe, Malcolm X. So I currently have 3 under my belt right now. I just finished the Rise Higher leadership program that UChicago Medicine actually offers their current staff. Out of a group of 9, my group won the presentation. So what we are presenting to upper leadership on Friday would be a mentorship program that we feel that all employees can benefit from. We will link current employees with upper management or any type of role that you're looking to go into. I started at UChicago working in a care transition clinic, and this clinic was a very new clinic dedicated to COVID. So we see a lot of immune compromised patients, COVID patients, COPD patients, a variety in this one particular setting. Here is where I learned, well, not learned, but I was able to utilize a lot more of my skills. So I do EKGs, I draw blood, I take out IVs, for which I learned that as a CNA, just following my nurses around. So I already, before I got into this position, I already had a lot of skills just by watching and observing other people around me. I'm like a sponge. So although I have the ability to go back to be a nurse, nursing was never like my forte, so to speak. Medical assistant, I like it because I kind of like work close with the patient. I work close with the provider, and working with providers, oh my God, those are totally different personalities that you have to learn each and every last one of them. So for me to be able to work inside of a clinic and get to know my providers and each personality and know things before they even want it, that's satisfying to me. And that's about it. And besides them always calling me for issues. And I'm like, go to your manager. But my leader, Tamika Wilson, she told me that people will always come to you, whether or not if you are in a leadership position or not, just based off of who you are. And I take that with me. So I've had a lot of people mentor me throughout the years, a lot of leadership, and I love the leadership that I'm currently under because they are pushing me to grow. A year ago, I could not do like public speaking. Today, I've been in meetings all day, so I'm kind of used to it now.
Thank you for sharing, Latricia. You're a natural leader, and I'm really excited about that mentorship program that your team has pitched at UCM, and I'm excited to see where that goes. I'll have to follow up with you on that.
Yes, we have I have to present it on Friday. So I have my executive director that's going to be on, my director that's going to be on, my manager that's going to be on, that's rooting for me. So it's good that I have like the support from my team, but then I have like all the higher ups.
Amazing.
So it's connections in this field.
Yeah, you'll have to report back to us how it goes. I'm sure it'll be
I
great.
will.
Friday.
I will.
Great. Erin, excited to hear more about what your day-to-day looks like and what you like about it and what you are still using from your skills working as a CNA.
Okay. So when I am at Advent Health Hinsdale, my day-to-day is mainly I get there at 6:45 in the morning and I get to pick my pod per se. So every nurse gets 4 rooms. Each 4 rooms is considered a pod or track. So sometimes I like to get what's called the trauma track because it consists of 2 trauma rooms and 2 regular rooms. And I'm kind of driven for that trauma ICU type of patient that comes in. Sometimes we get patients that are transfers from a long-term care facility. They might be intubated already. They are on a whole bunch of drips and they're coming in, and I have to take over for their care because they have some type of ailment that we need to make them feel better from. Or I might have a critical care patient coming in from a car accident or from incidental shooting or whatever. And because they're considered a trauma, we have to activate the trauma. Actually, Loyola is our trauma designation for level 1. So if they are a level 1 and we need to transfer them out, more than likely we're going to send them to Loyola for certain specialties. If they're not, we send them actually to the University of Chicago, and we'll send our life flight to come out, or UCAN, that's the helicopter. They'll come out after we wrap them all up, and they'll go to the University of Chicago. So I live for that type of thing. And then I also coordinate with the other nurses that's on the floor, with the PCTs that's on the floor. And we work as a team. No one's over anyone. I love the autonomy as a nurse where a lot of times patients will come in, I ask them what they're here for, and I can pretty much get started on their care before the doctors enter the room. So I can put in doctor's orders. I could put in some medications. I could put in some scans, x-rays, CTs. I can put those orders in, get them cooking ready. So when the doctor comes in, about 30 to 50% of the job is already done. And then I monitor my patients. I can make recommendations, say, hey, doc, my patient's not looking too well. Can we try this? If there's a specialty involved, it's all patient-centered. So we want to get the patient involved in their own health care. We speak to all the necessary specialties. I get to voice my opinion, like, I don't think that's right, or I think we should go this route. So it's good to have that collaboration because no one is over each other. And like Latricia said, like, I like to be a sponge. So with travel nursing, it's not that much different. It's just a different flow depending on where I'm going. So I've been in rural communities where they barely have anything to other level 1 trauma centers that has everything. So it depends on the setting, it depends on the location, and I learn things from every place I go, and I take it to the next place where I'm going. So for instance, at Hinsdale, we might have a patient who's undergoing some type of psychiatric breakdown, but they are a resident of Wisconsin and they have Wisconsin insurance. Well, if we have to admit them, their insurance is not going to pay for it. But because I had worked in Wisconsin, I know of locations in Wisconsin where we can send the patient, where we can refer the patient. So I use what I've learned in the past to my current position. I am also qualified to insert IVs using the ultrasound machine. So this is called ultrasound guided IV insertion for our difficult patients, whether their veins are too small or if it's an obese patient and their veins are too deep and there's like these IVs that are about 2 inches long, and I can guide it into their body with an ultrasound machine. I'll get phone calls from other floors and so I was like, hey, I have a patient, I lost their IV access, they're difficult stick, can you come upstairs and start the ultrasound machine upstairs and go start those IVs? And then again, it's like there's so many things within nursing where doors are open. So I took that opportunity to dip my foot into sexual assault nursing and trauma nursing, and so now I go between 4 other hospitals in case if there's a patient who's a victim of sexual assault, and if they need a rape kit done, I can do that. I can coordinate with our SART, which is a sexual assault response team. So I'm talking to different police departments. I'm talking to other forensic nurses. I'm talking to lawyers. I'm talking to judges. I have not yet, and let's knock on wood, have not yet had to go to court to testify on the behalf of a patient. I'm very capable if I have to, but those are other skills that I have to procure. And I love babies, so we see pediatric patients as well. However, if they're younger than 6 months, I tend to let the pediatric nurses take care of them because it's too much heartfelt emotions going in regarding to those patients. But with like 6 months and older, I do IVs. I've had to do resuscitations on babies before, so it's like you pick up so much on on all patients and all populations, and there's a whole bunch of skill sets that you have to learn.
Awesome. Thank you, Erin. I think another theme I'm seeing is just how easy it is to move from one specialty to the other and sort of build on all of these additional credentials once you've entered nursing. And I know that
Yes.
Jenny can speak to that as well. Let me turn it over to you, Jenny, to talk about your current position.
Sure. So I definitely feel what everybody's saying. As a CNA, in the hospital setting, I learned a lot. I got a lot of certifications when I was working too. So I had EKG certification for the telemetry. So I was able to read heart rhythms. I got the wound certification. I like that you can learn so much. So even though I was going into nursing school and I already knew what I wanted, I thought there was like a learning experience with everything that was offered. And the hospitals usually have those certifications within, which was like even better. So I had like those trainings within my time working there. As I was learning more and I grew, I learned that all of those things just came together. When I was going to nursing school, I wanted to actually be an ICU nurse. But since I graduated in the pandemic, while everything was happening, I decided that I didn't want to do anything with the hospital. So I decided to take some time off away from the hospital because it was chaotic. And I had been working since I started. So I decided to do school nursing, and then I got a pediatric contract where I was going with children from ages kindergarten to 12th grade. So that gave me some of the pediatric foot on the door. And I decided to focus on the children at that moment, just because children have a different spirit than adults. And it was kind of refreshing to me. So I started working with them, and that's what motivated me to just seeing all as a whole, right? I had worked with adult for so long, especially Gero. And then just I felt so comfortable. I was like, okay, children are giving a different light to me. And I can make a difference here. All the bad habits that we start forming when we're adults can be changed when we're children. So that's what motivated me to take to being that psych nurse. But something that CNA gave me was my bedside manner. I can talk to anyone without feeling in any way. Like I feel everybody has equality. Doesn't matter who you are, what race, how much money, what position. To me, everybody is the same. And I think that's what's beautiful about starting at the bottom. It really teaches you to be comfortable with everyone. So that I feel great about. Even as I kept getting more certifications and whatnot, I always feel like we're all a whole, and as a collaboration team, we can make things happen, especially if we appreciate everybody in everybody's role. Because I met a lot of CNAs too and PCTs that have worked for so many years, and they're so vital to the team. If everybody were to become something else, then we will be lost, because I counted on so many CNAs to learn too as I was going to my nursing school. If I did not have them, I don't know where I would have been either. So I think that's important. I decided to keep going because I told myself I like learning. I have that personality that if I don't know something, I keep going up the ladder too. I actually stopped just a little bit because I had a baby in June, but I finished my doctorate this month. So I was doing the NP program and the doctorate, and I really don't know how. It's a little just the in me of wanting to make a change, because I feel like if I get more, I can do more. And that's my personal motto, right? For myself. And they say that we are the hardest to our own path of what we want to do. But I'm happy. I'm happy that I was able to accomplish all this, and I can make a change in everybody's life with diagnosing and prescribing now. That's the route I wanted to take.
Amazing. You are clearly a lifelong learner. But I really appreciate you mentioning as well that, even if you aren't, if that's not what you want to pursue, if you want to continue working as a CNA or a PCT, your skills are so vital and you're such a vital part of the team. And everyone else on the team knows that. That's a really important thing to remember, Jenny. Thanks. Jamia, tell us about your work as a social worker.
Okay, so just to back up a little bit, being as a CNA, I found out and learned that I am very squeamish when it comes to blood and guts and all things that come out of the human body. So that was another reason why I wanted to go a different route rather than going into nursing from a CNA. The current practice where I work in right now, social work, like I said, I work on the south side of Chicago, in the Inglewood neighborhood, where it's really needed for behavioral health, substance use. We get a lot of our clients, they're referred from hospitals, from someone going in for a psychosis episode, and they're seeing us to maintain their stability outside in the community. So most of my job is being able to provide resources to those individuals, whether it be something financial that's difficult for them, helping them apply for Social Security, SNAP benefits, things of that nature, linking them with a psychiatrist that they can see on an outpatient schedule, completing home visits, seeing if there's anything in the home that I can help them get. If I notice that they're having difficulty navigating, talking with their insurance company, seeing if we can get walkers, canes, whatever mobility things that they may need to get around, and linking them with other services. If they need a home health care aide, if they need, someone to come and help them for housekeeping services, those types of things. And I found real joy in doing that. I always considered myself a very resourceful person. As far as my skills that have transferred from CNA to social work, I can say active listening is the top one. Being a nurse's aide, you're listening to that patient, that client. You have to be able to relay that information to your nurse. So just like with a CNA and you're working with a team of people, nurse, doctor, physical therapist, you name it, you're doing the same thing as social work. You're working within a team of people, and all of us together are able to help the client, make their decisions that they need to make or be able to provide that care. Besides active listening, I can say empathy. Being able to empathize with our patients, with our clients, being able to put aside any type of biases that we think about someone, because we never know where their background is, and we're trying to get them to be the best version of themselves.
Thank you, Jamia. I think so many of you have pointed to patient care and bedside manner is something that you're learning from day one that you, for many of you, have continued to use, even if you're in more of an administrative role or leadership role now. And I also appreciate you mentioning that you know, the blood and everything made you a little bit squeamish. If that's true, you can still find a career in healthcare, a very important member of the healthcare team. So thank you for sharing that. I'm going to ask one more question to all of our panelists and ask you to keep it a little short and sweet. Maybe answer this in just a couple of minutes, so then we can move on to some audience Q&A. What advice do you have for new CNAs who want to advance in their careers, but maybe don't know where they want to go yet? Or maybe they do know where they want to go, and they'll need to figure out how to balance the going to school while working, all of the demands that come with career growth. And if you'd like, maybe reference something that really helped you with your career navigation. Oh my God, but Jen, first, I'm so sorry.
I can start. You want me to start with this one? I'll
Yeah,
start with
you know
this
what?
one. All right.
Yeah, that
I'll
sounds
start
good.
with this
Thanks,
one.
Jen.
This is more up my alley. They don't want to hear about nursing, boring administration and nursing now. Everyone else was way more exciting. So, but I think this is a good one for me. So I think being transparent with your leader. Okay, making sure your leader knows, hey, I'm going to school on Tuesdays and Thursdays, and letting them know what your schedule is, right? And not like swinging it on your leader right away of like, I need Tuesday and Thursday off and the schedule's already done for the next 6 weeks, right? I think a lot of us support everyone going back to school. So I think being transparent with your team, with your manager, letting them know I'm in school, you know, I'm working 3 to 11. I have 2 children at home, and being transparent with what your goals are with your leader. I always love to sit down, you know, especially during eval time, and sit with my TCT, CNAs, nursing assistants, and say, where do you see yourself in 2 years? You know, and how can I get you there? You know, and they might say, I love what I'm doing right now. I want to stay here for 2 years. Great. Or they might be, you know, I'm getting kind of burnt out. And, you know, we always say, well, you could be a Trinity Loyola nurse employee for life, right? And if you don't like one area, if you don't like what you're doing at now at McNeil, you could go over to Loyola and go into the ER or the pediatric unit or the NICU or ambulatory. So you don't have to, we say you don't have to leave the organization. Let me find somewhere where you will be happy. Because I want my employees to be happy, and I want them to be, and maybe it's being led by me, but maybe it's, and I can help them get to another department. So I'll call other departments and say, hey, I got a great employee here that wants to try out the PICU. Can she come shadow? Right. So really being transparent and with your leader of what you want to pursue, and don't be afraid to try new things. Like if you get floated, you know, I remember many of us have gotten floated, right? You're in the ER and you're like, oh, I got floated to ICU, or oh, I got to go to med surg. Don't be afraid of it. You know, because you see everyone's different perspective then, right? Every department thinks they're the most important department in the area. But when you float down the ER and you're like, damn, it's really busy down there. And no wonder why you know, it takes them so long to get the patients up. Or no wonder why ICU is so busy and can't get the patient over to med surg. Be willing to try new things and be transparent. Don't burn bridges. I think we've all said that, right? Healthcare in Chicagoland area is so small. Everyone, like me and Erin could talk right now, and I guarantee we have 7 nurse friends that we all know, right? And healthcare is so small. So people will say, oh, you worked at Loyola for a couple years. I'm going to call, or oh, you're at Hinsdale. I'm going to call my friend Erin. Erin, do you know Jen? She worked with you for a while. And Erin could be like, oh, yeah, she's great. Or Erin could be like, ooh, I don't know. You know, so don't burn bridges. Always, you know, when you leave an organization, leave it respectfully, because Chicagoland is so small, and we, you know, it's so big, but it's so small at the same time in healthcare.
Oh, Jen, thank you. It was good to kick this
Yeah,
one.
that was a good one to kick off with me. They
Thanks
don't want to
for-
hear about boring admin stuff.
And just I want to highlight for anyone listening to this that I'm almost sure that you're working for a system that has tuition supports and has
Yeah.
other programs if you are interested in continuing your learning. So if you're not sure what those are, ask your supervisor. Do what Jen said. Be clear with them about your intentions and ask questions. With that, Latricia, do you have advice?
Yes. I do agree with Jen. Um, have those max conversations with your supervisor, and this is kind of letting them know what your future goals are, what your plans are, and what they can help you with. Because they may have connections to HR where they can get you the support. It may be systems like what we have in one of our systems is called Absorb. So a lot of courses your facility can actually offer, that'll help get you certifications in different areas. One particular coworker stands out. She started off in environmental services. The university offers this Rise Higher program. Now she's working as a patient scheduler. So that was a big change from working in environmental service to now she's a patient scheduler. So facilities do have the tools that you need. You just have to reach out. Also, stay in contact with HR. See what benefits they have. See what they can offer you in pursuing your healthcare goals. And don't be afraid to pursue other things. It is so much. The healthcare is so huge that you can do so much from administrative to clinical. Some people have more administrative skills than clinical. Some people have more clinical. I've managed to master both. Um, but always keep those connections open. And one final story that I'm going to tell is one of my mentors in the Rise Higher Leadership Program, just talking to my best friend that's outside of the job, knows him. So always keep those connections. You never know who's connected to who. I've been knowing my best friend for well over 15 years, and I did not know that she was connected to my mentor. So keep your options open, longevity, and also play around with different things.
Connections keep coming up. Love that. Aaron, what advice do you have?
Yeah, it's almost the same thing as Jen and Latricia. What kind of helped me was to form mentor. My mentor is actually a nurse practitioner that I worked with when I was a medical assistant. Her name is Karen, and she got her NP, isn't even required to be a master. So she has her BSN, but she has her NP license. And she's the one that kind of pushed me. She was like, "You're not going to be a medical assistant for the rest of your life. Go into nursing." And I was proud to show her that I got my nursing degree, and I still keep in contact with her. And just as Jen said, like the healthcare field is small. We service a lot of people in the Chicagoland area, but you're always able to make connections. Um, Having that conversation with your manager about where you want to see yourself in the future is very important, but also having that conversation with your family is important as well, because your next career goal can take you away from your family, and you need to be both mentally and physically prepared before you make that journey. Um, when I went to nursing school, it was a accelerated program. So I had used my medical assistant's degree to go into nursing school. And one of the first things they told me was say bye-bye to your family and friends for the next 2 years. And I was like, well, I mean, that shouldn't bother me. But as time progressed, um, I was working 2 part-time jobs as an MA and as a PCT and going to school full time. And it pretty much pulled me away from my family. I had a lot of catching up to do after I finished. And so that's another thing. Make sure you are mentally and physically prepared. Have that conversation with your manager, have that conversation with your family. And because you have to look beyond. You still got to deal with work, you still got to deal with bills. So you have to look beyond, make sure that you're financially prepared to make that goal as well.
Really important advice, Aaron. Thank you. Jenny.
I'm still taking everybody, and I'm like, yes, everything is all right. Well, I want to say that what I would say is try to make the best out of the hard times, because we all go through obstacles, and that sometimes can create setbacks in our education. But at the end of the day, if you really have your heart in something, you can make it happen. I remember when Aaron was speaking, I recall seeing this nurse practitioner working at the hospital. I was like, oh my God, I want to be like her one day. You know, I was here working as a PCT in my 20s and going to nursing school. And sometimes that goal can seem kind of far, especially when you're doing your prereqs and you're like, maybe one day I'll do it. Let me focus on my RN first. But with that said, I mean, it took me quite a while. At first, I was working as a CNA. I started working with that role because I actually didn't have my papers. I was working as a foreigner from Peru. So it was hard. Things were harder. Back then, there was no DACA. So there was no dreamers. So everything had to be paid in full. So since I was 18, I was working full time, paying for college. I paid 2 associates out of my pocket working. And it was hard. I didn't have kids, but I was working a lot, putting my butt off into everything, and I made it happen. Um, I guess I share the story because a lot of things happen in everybody's life sometimes that can be very easy to just set us back. And like everybody mentioned, there's always somebody though that reminds you that, hey, Jenny or Aaron or Latricia, right? I seen this in you, and you have it in you that you can get this done. And I think you can. So whatever it is that you set your heart into, it is possible. It is achievable. And yes, you do give a lot of your time. I'm here like, okay, I finished my doctorate. It's time for me to be with my family because I have been so committed, go, go, go in my studies that it's time for me to give back and actually enjoy the fruit of my harvest, right?
Well, I'm inspired by the persistence and achievement of this group. Jamia, anything to add to all of this great advice?
Yeah, so to piggyback off Jenny, knowing that my advice would be knowing what your heart is into, being realistic with that. A lot of times, people will come into the field because of financial reasons. They need money, which we know we all need that to survive, but the longevity of it, you got to actually like it. You got to have something that inspires you to get up and go and complete the job. So you want to make sure you weigh the pros and cons of the different fields that's in the healthcare field. Like I said, I knew that blood and guts was not for me, so I didn't look at nursing or any of those types of positions because I knew that long term, even if I miraculously made it past all the vigorous testing, I was not going to stay happy in that. So being able to, take that time to get to know yourself and what you would like, because there's somewhere in the healthcare field where your good deeds can be used.
Yeah, amazing set of advice from everyone. I'm inspired. I have one question in the chat, but then I want to let everyone on the call know that we're ready to take your questions. If you feel more comfortable typing it in the chat, or you can just come off mute. We're a small group. So I wanted to pose a question to Aaron. What can healthcare organizations do to attract more men into healthcare, and specifically men of color?
Well, I believe what we can do is all of our respective institutions, whether it's Loyola, UChicago Medicine, Advent Health, Northwestern, Advocate Aurora Health, whoever it might be, they should go out to the nursing schools and the PCT schools and give incentives to attract more males to come in. And also utilize the males that they have that's on staff to attract more males to come in, especially those of color. It's already known that males and people of color are disproportional in most employment opportunities. So for those who have made it or who's in that field, I wouldn't mind advocating for Advent Health to say, hey, you know, this is me. This is what I've gone through. This is why you should come and work for us. I've made it and you can be that. You can stand right beside me. So we just need to give words of encouragement. We need to actively go out there. We need to actively pursue those demographic criteria to invite those into our field.
Thank you, Erin. I'm happy to report that the Chicagoland Healthcare Workforce Collaborative is involved in a project that has some of those goals that I'd love to talk to you offline about at another time. But thank you for sharing that. Questions? Anybody? Feel free to just pop right in.
Hi, this is Candace from Rush. I have a question for the entire panel. Most of you mentioned that you have had mentors over the years. What were some of the ways that your mentors assisted you through your career journey?
Great question, Candace. Who wants
I
to
think it's always having that mentor to call. I actually just reached out to two of my mentors today. Actually, Angelique Richards from Rush, and so I think always having that mentor to call, and no matter what system you're in, and I think that's so important. Continue that relationship no matter where you go. Have that one person you could call and say, "What should I do about this? Should I go here? What salary? Does this salary seem right? Are these good benefits?" Like, that's kind of the stuff I used to call my mom for when I got a job, right? And now that I'm an adult, I can't call my mom all the time with that stuff. So I have that one mentor you could call all the time to say, "What do you think? I want to bounce this off of you."
For me, this is Latricia. I had to turn my camera off. My phone was dying. For me, one of my mentors, she told me that moving into leadership, there is a transition. I did not know that before I got the role, that there is a transition because you're not, although you are the same person, you are a little higher than your peers. And you still have a job to do, whether or not if that's your friend, buddy, whatever the situation may be. So that's one of the best advice she gave me. And she's actually my director because I called her crying one night because I was like, "Oh, I can't do it." And she was like, "Breathe. It'll be okay." So having that person that you can go to vent, get it out, and also motivate you.
And I have a piggyback, Erin, I'd love for you to respond to that too, but I also have a piggyback question on Candace's, which is how some of you have found your mentors. But go ahead, Erin.
So my mentor, again, her name was Karen. I actually worked with her for 10 years. What I was doing was I was taking on too many roles as a team lead and medical assistant at Access Health because I worked in a school-based clinic. And pretty much we saw patients from like 2 to 25 that was part of the youth center and a high school on the south side of Chicago. But she noticed that I was working really hard to make myself more marketable within the institution, but I wasn't attaining the like the pay towards it. And she's like, you're doing all this stuff, but you're not really going far. You need to invest more in your education. What are the roadblocks that's preventing you from going? And I had to think about it. I sat down, I had a conversation, and she was like, I'm going to show you different things to nursing. And so she showed me things, what she does, and that kind of was the fuel to my fire. And all she just kept doing was adding more kindling to it. And anytime I had questions during nursing school, I would come bring to her like, Karen, they said this in school and I don't understand. Help me out here. And she would break it down in a way where I could understand. And as I got older and went through the program, my clinical instructors are also my mentors. And so as I'm working in nursing, I do get to precept nursing students. I do get to precept new employees and EMT students and first year medical residents. So I kind of throw them into the fire as if the same way that my mentors did to me. And I want to form a partnership. So it's like it's all about the partnership and honing on those skills. So that's what I really appreciate about my mentors is what they did to me. I'm able to pass that along down to other people.
Amazing. Any other
And
questions, Sasha?
just to finish off of that, for me, how I got my mentors, I have a lot of them, but she's just the one that sticks out, is she's my director. So we lost our manager last year, and our manager did a lot that she did not know that she was doing. Fortunately, my manager had pre-trained me, so I was able to walk her through the role that my old manager was doing. And from there, we just developed a relationship. And she also mentors my daughter as well, because my daughter also works for UChicago Medicine.
I wanted to say that throughout the years, I don't feel like I've had one mentor actually, but in my faith and belief, just people that God has put in front of me that has helped me get through each year and learning. I see that everything that I have learned and the people that have helped me, whether if it was with my schedule or whether if it was with tuition reimbursement, whatever it may be, I feel it's just God sent people for me to be able to achieve the next step in learning. So sometimes it's not a 10-year mentorship, sometimes it's not a 9 or 5, and you'll see them later though. And then you'll see that, oh wow, I remember this person when I was going through this. But I feel like to me, it's got people sent and just guidance through my whole years of experience.
Thank you, Jenny, and all. I think hearing the different versions of mentor, like who is a mentor, who you consider a mentor throughout your career and as you developed, is I think really helpful for those who are here and who will watch this after. That there are formal programs, but that are initiatives to want to establish more of those relationships and create exposure, because it can be difficult to meet. And for people who have time to also mentor, it's kind of lifting all that up. So it's great that that's happening. And I think what you just mentioned, Jenny, that I heard across the entire panel is that maybe just as important as having that person or that mentor is just being open, having a real openness to what you're exposed to, who comes into your life, what experience, positive, negative, awesome, celebratory, uncomfortable, terrible, because you're learning a lot about yourself along the way, and that people can certainly be mentors for you, but that being open to what you are encountering throughout day to day and then over your career, and just having those spaces where you can talk to someone you trust and lift up and be able to have someone reflect back or be that collaborator or thought partner with you to think of what's next is really probably just as important. If you're nervous about like, oh, how do I ask somebody to be my mentor? So one other just a related question I have for the panel was, several of you mentioned or recommended connecting with your direct supervisor about your hopes and goals. And just, I think in a very real way, or for those who out there might not have a great relationship with their supervisor, what would you recommend to someone who really, the CNA, PCT, someone who wants to advance, but maybe they feel a block from their direct supervisor, or just don't feel that support? Like, where else and how else could they go about it?
So if you are a person that's not in direct or have a positive relationship with your direct supervisor, you can find another person, like a nurse that you've befriended, or a manager in a different department, or it could be a family member, or it could be another type of like social acquaintance. It doesn't have to be necessarily within your direct supervisory role or your direct department. However, the communication needs to be, it needs to be direct, saying, hey, this is my plan. So as I went through nursing school, I had to leave Access Community Health, but I never lost contact with my mentor. Um, your life is supposed to be within your control. And sometimes, yes, if you want to go to your direct supervisor and you tell your direct supervisor, hey, these are my plans, your direct supervisor may put you in a position where you might have to leave that position, or they'll put you where it's uncomfortable for you to continue just to prove a point. Your goal, your dreams, your aspirations is more important than that supervisor's schedule or that supervisor's need of you. So if you can't utilize that direct supervisor, just maintain that communication. These are my plans, and be firm and be active with your communication. And it's a two-way street. So if your supervisor said, well, I don't think this is going to work, then your next goal is to find a position where it can work.
And also,
I also think it's
sorry.
I also think it's important to work for a manager that supports you. You know, 90% of employees leave. I'm making up that percentage, but it is something that's high. Leave because they're not supported by their leader. People leave their leader. So just, I was very fortunate enough to always work for a leader that was great and always supported me. So not that I want people quit their jobs or job hop or anything, but you should work for a leader that supports you.
But also, I guess I like to tell from like my experiences. I had this one, this is Latricia, I had this one supervisor that was mean, just mean to everybody. And one day I pulled her to the side and I just simply said, are you okay? Is everything okay? Do you need to talk? She was having issues that she was taking out on other people. So you're gonna run into that. It's how you handle those situations, but also not take everything personal. But just like Jenny said, also work for someone that wants you to succeed, wants you to grow. I've actually turned down a job just because she stated to me, FYI, never tell a job that you're going back to school. I said, okay, then you're not the right person for me. And here I am, you know, and I've grown, not just in my profession, but I've also grown personally because they both tie in together. And sometimes it's how you handle those tough situations because you're going to be in them.
Yeah, I wanted to say also you can always reach out to HR. I think I said it in the thing, and do more of a formal route if they're hard to communicate with. Kind of like email, backtrack. Hey, I want to communicate that I'm going to be starting school. It's going to be in 3 months or 6 months or whatever the case may be. I'm going to need to be taking off these dates because I'm going to be going to school. And then there's kind of like that formal communication. And that way, if they forget or whatever the case may be, you can say, I have this, I send it to you. I let you know in advance. I need these days off because of school and I will still be working. If you have been a certain amount of years, you need to stay for whatever reason, insurance reimbursement, whatever the case may be, and always go follow up with HR if that's the case. Now, yes, I agree 100%. If you feel uncomfortable, the best thing would be just to leave if you can. And yeah, I mean, I've turned down positions too because they didn't accommodate with me. It's okay. It's okay. Sometimes life has better things for you too. Sometimes though, it's just going over a hump with certain people and certain individuals and certain characters. It depends on people's personalities. So at times, if you just send one email, a formal email, and then you do, hey, I would like an appointment with you so that we can discuss this. If they don't collaborate, at least you showed that you have that approach, and then that you can communicate with them, and you have that for your record, and you can be dismissed or fired in case they want to be difficult with you.
Thank you for adding that, Jenny. We're coming up on time, so I just want to point out a couple of things. If you are a new nursing assistant or patient care tech or currently in training for that, I put a link to a survey in the chat. I'll put it in one more time. I would love to hear what you thought of this event. Because it is only the first, it's sort of a pilot test run of the types of events we'd like to do over the next year. We'd like to do some in person. We'd like to mix up the format, provide some different types of content. So we really want to know what would be impactful for you. Also, I put in my email in case you want to have a conversation about that. I think we have time for one final question. If anyone has a burning question, or to our career pathway advisors, if there's anything that you didn't have the opportunity to share yet that you'd like to share. Well, this was a fantastic conversation. I'm leaving with some themes that are, top of mind. One being that, it takes real heart and drive and passion to work in healthcare. And number one, you have to make sure that that's what you want to do. And then it's connections and mentors and family that gets you through. I feel like those themes came up over and over again. I really appreciate all of you. Shonda, did you want to ask a question, or are you getting ready to take our group picture? Shonda's offered to take a picture of us.
Take your group picture. I just wanted to say I have had an amazing time this evening. Just all the information that was shared. Oh my goodness. This replay is going to be like phenomenal. And I think we should definitely share with amongst the CHWC community, because individuals that are even thinking about and contemplating, even if this is their career path, hearing from all the panelists today has given, I think, every perspective, like from CNA to no longer wanting to be a nurse, from CNA to MA, from MA to C, like all the different routes that a person could possibly think, like all the way to like top leadership. I mean, oh my goodness, this has been like an amazing panel that you put together today. And I think the information that was shared was just really heartfelt. You all really were transparent and really brought your true selves. And I just want to say thank you from the bottom of my heart. I have the pleasure of working with Jen Grenier at Loyola Medicine, and this has just been like a phenomenal panel conversation. So thank you all so much for sharing.
Thank you, Shonda, for illustrating what I think we were all thinking. Latricia, do you have enough battery in your phone to come on camera just once more for a picture?
Yeah. And I would just say, to quickly add before we wrap, that for those on this call or who are watching it after, you heard the stories of this amazing panel and the different journeys. And so we would encourage, if this sparks ideas of other individuals in your networks, started out in healthcare as a CNA, this was an example of like one way we really want to create exposure and make it more possible for CNAs currently to know what's out there and to advance. So we would love to enlarge the circle and the network of those who've made those moves and want to share their stories too. Great to see you, Letitia.
Okay, you have a few bars now.
Okay. All right, everyone smile. Shonda's gonna do a screen grab. Yay.
Hold on, sorry, let me come off mute. So I'm gonna count. On the count of 3, because I want everyone to smile in the picture. I want to smile too, because the way the boxes are set up, I'm in the picture. So 1, 2, 3. Okay, hold on. Let me see if that's everyone. I think that's a good one. Okay, hold on.
Awesome.
Don't move. Don't move. Let me take it. Oh, yeah, that's cute. Okay.
All right. Thank you, Shonda. I cannot thank all of our panelists enough. Thank you, Jen, Latricia, Aaron, Jamia, and Jenny. I will be following up with everybody on this call. I'll send you the recording tomorrow or the day after. Advisors, I'll be following up with you separately as well. Thank you to everyone who could join. I'm so excited as well to share this with others with the recording. And with that, everyone stay warm and dry out there on this chilly, windy, rainy night. And we'll see you next time. Thank you. Thank you so much.
Thank you, everyone.
Thank you.
Everyone, take care.
Bye.